The deadly Ebola outbreak is now spreading to African cities. Earlier today, Liberia's president ordered most government workers to stay home another month in order to stop the spread of that virus. Meanwhile, Senegal has confirmed that a student in the country tested positive for Ebola, making it the fifth West African country affected by this outbreak. The World Health Organization estimates that up to 20,000 people may contract the virus before it's brought under control. That process could take about 6 months. Joining me now is Dr. Robert Salata, infectious disease specialist at the University Hospital's Case Medical Center in Cleveland. Sorry, that was hard for me to get out. Thank you for coming to see us today. What makes this outbreak so much deadlier than previous Ebola outbreaks?
So part of it is that with travel as it is and people fleeing areas of concern where the infection is occurring, this has led to spread. And I think that's one of the themes we see in any potential infectious disease outbreak. In addition, I think the medical infrastructure in West Africa has been different from places where Ebola outbreaks have occurred, primarily in Central and Eastern Africa before. That said, because of the poor infrastructure and the hospital settings, the initial failure to recognize cases, and some of the practices that occur during burial rites, etc. As we know, Ebola is spread through very close contact. This has really led to the continued spread of infection.
We're seeing now that Ebola is spreading to major cities. Will that increase the pace of the spread?
Because of the population densities in these large urban areas, it certainly can add to this, and that will underscore the concern that the World Health Organization has related to levels of infected folks of 20,000 in the next several months. Right now we're at a count of about 3,000, but remember that is confirmed, laboratory confirmed or suspected cases. Many families are keeping ill individuals at home because of the stigma and because of access issues. And because of that, this number probably represents a gross underestimate of the true level of infection in West Africa.
Let's talk about vaccines. Given the fact that the families, like you just said, are in fact doing this vaccine availability, what will it actually take for vaccines to become available to more patients?
Well, there is a process where we take vaccines or any new drugs through different phases of testing. The vaccine that will be pushed out and was announced in the last several days by the National Institutes of Health is one that will be undertaken in a so-called phase 1 trial. This is in otherwise healthy individuals, not in the areas of concern right now, but that needs to be done to establish certainly safety, tolerance, as well as some readout on how effective it is in stimulating the immune system. Once that is shown in a relatively short period, because it is estimated that about 20 individuals will serve as the initial group for vaccination, then it will be taken to a higher level called phase 2, and that can include some individuals who are at risk for or already are infected. We hope that this vaccine not only will be helpful preventatively, but in the aftermath of infection to change the course of disease. Phase 3 would be the level at which broad use of the vaccine would be employed in populations that are in the areas of concern. And the manufacturers of the vaccine have pledged that they will start to produce this in a major way and make this available to the individuals currently faced with such a devastating outbreak at this time.
Let's talk about the concern about medical care for these patients that are receiving it right now. Has the death of leading doctors deterred other doctors and possibly nurses as well from going there to help out?
So in the infectious disease group and institutes around the world, there's been some petition for people to get involved on the front lines. But this has to be balanced by the concern for infection that's already occurred in healthcare workers, and that should not be underestimated. On the other hand, I think one of the things that really is the big push right now until either drugs or vaccine become available for use here is increasing and making more efficient the infrastructure in their hospital systems. And I think that has to be centralized. That's being done with the World Health Organization, our own Center for Disease Control, European groups, and I think that will be the big push in the next several weeks to make sure that there are adequate supplies. We've heard of the lack of things like gloves and other protective personal measures for healthcare workers. And I think all of that has to come into play in order for us to try to contain this. Now, isolating these patients is important from others that are not infected. And there will be many attempts not only to improve the infection control measures, but to improve the medical care conditions on the front lines, as well as vigorously look for treatments and/or vaccines.
Dr. Robert Salata, we'll have to leave it there, but thank you very much for being here with us today.
Thank you.
President Obama is missing a self-imposed immigration deadline. He said in June that